there, Jane Font, is it?
Yes, hi.
Hi, I'm Dr. Sadiq. How can I help you?
I had a little bit of an accident. The condom split 4 days ago, so I've come in to get the emergency pill.
Right, okay. Just tell me a little bit more about what happened, if you wouldn't mind.
Well, I've been on the pill, the normal pill, and I ran out about 3 weeks ago and I forgot to come and get a repeat prescription.
Okay. And so 3 weeks ago you ran out, and since then have you been using condoms?
Yeah, just condoms,
Okay. And 4 days ago you said that the condom split and you had that episode of unprotected sex.
Yeah.
And was it just that one time
that
it happened? So since your last period you've only had that one episode, is that right?
Yes.
Okay. And when was your last period?
3 weeks ago.
And was it a normal period?
Yeah.
Okay.
Just as the GP shows here, it's really important to clarify exactly how many episodes of unprotected sex have occurred since the last period. This is because it helps you decide, if any, which type of emergency contraception is most appropriate.
And that was after the end of your pill packet, was it?
Yeah.
Okay. And during your pill, when you were taking the pill, did you manage to take it every day? Did you miss any pills?
I'm not great at taking it. I can miss the occasional one, unfortunately.
Do you know if you missed any in the last pill packet?
Maybe a couple.
Okay. Jane, is it all right if I just ask you a few more questions, just to so we can try and work out what the best sort of management is for you? That's all right. So this episode happened 4 days ago, and since then you've not had any further episodes of unprotected sex?
No.
No.
The first few minutes of any consultation are really important in history gathering. The GP shows here that she's summarising all the important points within the first 90 seconds.
Are you in a relationship at the moment?
Yes, we've been together for 2 years.
Oh, right, okay. And are you happy in the relationship?
Yeah.
Okay. And I just have to ask, it was consensual sex that you were having? Okay.
By asking this question, the GP is making an assessment of any safeguarding risks. This question can be phrased in a variety of ways depending on the type of patient you're consulting.
And I mean, I know that you've come in today wanting the emergency pill. Was there anything particularly that was worrying you at all?
The GP demonstrates really good listening skills here. She's not repeating aspects of ICE which the patient has already given to her early in the consultation, but is concentrating on the parts that she needs to get information about.
No, not really. I am thinking maybe the contraception that I use probably isn't maybe the best for me.
I was going to have a little chat about that as well.
Maybe.
Okay, so that's your main concern.
Could do maybe a bit more information about that really, because I'm not quite sure what to do.
Yeah, sure, no, definitely. I think that would be a good idea. And then the other thing I was just going to say to you was, that was one of the things you were worried about, but in terms of what you were hoping to get today, was it just that you wanted the emergency pill today? Yeah,
and maybe a repeat prescription for the time being for the other pill.
All right, okay. We can certainly have a look at that and see what we can do. Is it all right if I ask you a couple more questions just about your life, just because you've not been in recently, just to see where we are?
Yeah.
So are you a smoker at all?
Yeah, only about 5 a day.
5 a day, okay. And is that something you'd thought about stopping, or?
I'm all right at the moment.
At the moment?
Yeah.
Okay, that's fine. What about any alcohol?
Only 1 or 2 units, not much.
Any other drugs at all?
No.
No, all right. And do you work, Jane?
I'm studying at the moment. I'm at uni.
Oh, brilliant. Okay, what are you studying?
Psychology.
All right, excellent. And what about, who do you live with? Are you living with your boyfriend?
My parents.
You live with your parents? Okay, that's fine. Is it all right if we just examine you? Is that okay? So what we'll do is we'll just check your blood pressure, and we'll check your weight as well, and height, if that's okay. And the other thing I'd just like to do, just because you've missed a couple of pills in your pill packet, if we could just do a pregnancy test as well, if that's okay.
A general good point is to explain exactly what types of examination you want to do. The GP here justifies the reason for a pregnancy test, which is really well done.
Yeah, that's fine.
All right,
yeah.
okay, we'll get those things done then. Okay, so that's fine. Your blood pressure is perfect, and your height and weight is fine as well. All right, pregnancy test is negative at the moment.
Good.
So just coming on to talk about the options that we have. So if we start first of all with talking about for the episode of sex that you had 4 days ago, and then if we talk about the contraception longer term after that, if that's okay.
Yeah.
So in terms of for the episode that you had 4 days ago, you said you wanted a pill.
Yeah.
Were you aware of any other methods that are out there at all?
By asking this question, the GP is getting the patient engaged into the consultation and helps her to achieve a more patient-centred approach.
Not really. I hear this and that, but not really. I don't really look into it that much.
Okay, so I can just tell you a little bit about that, if that's all right. So the first thing, as you rightly said, is that there is a pill that you can take. There are a couple of pills, but because it's been 4 days since that episode of unprotected sex, there is one particular pill that we'd be looking at called Ella1, which is a pill that you can take. And we can talk about that a bit more in detail once I've just told you about the other method. The other method of emergency contraception is what we call the Popper Coil. Have you heard of that?
I have heard of the coil, yeah.
And how do you feel about that?
I'm not very keen on that idea.
Okay, can I just ask why?
It's just the thought of having it in there, yeah.
Okay, I mean, that's fair enough. Some women do feel like that. Just to let you know that the Popper Coil is the most effective, so it's probably around over 99% effective at preventing a pregnancy for emergency contraception. But Ella1 is an alternative. It's less effective than the coil, but it is still effective. So that's something that is that what you'd like to pursue, that one?
I think so, yeah.
Okay, that's not a problem. We can give you a prescription for Ella1. Have you taken it before?
No, I did have a termination last year, and I don't think it was that. I did take a pill, because it was quite early on in the pregnancy.
Okay, so you took a pill to end the pregnancy,
Yeah.
did you? Okay. Did you seek emergency contraception after that episode?
It was too late.
It was too late, okay.
Yeah.
All right, so generally, the sooner that you seek a medical advice after an episode, the better it is, okay. All right, so we can give you the Ella1 pill. You just take it once, so as soon as you pick up the prescription, take it straight away. Just to let you know about some of the side effects that people can get with it. Some people do feel a little bit sick with it, and if you do actually vomit, if it's within 3 hours of having had taken the pill, then we would ask you to come back and get another prescription because you'll need to take it again. Okay. The other thing is that some women can get a little bit of stomach cramps with it as well. So just to be aware of that. But if you do get severe tummy pain at any point before your next proper period, then you need to seek urgent medical advice about that, because there is a small chance of what we call an ectopic pregnancy, where pregnancy implants just outside the womb.
The safety netting advice given here demonstrates a safe management plan.
Okay. Are you aware of that? Okay. And the other thing is that Ella1 can sometimes cause a little bit of disruption to the periods. So that can mean that some women get a little bit of spotting, some people's periods are a little bit earlier than usual, some are a little bit later than usual. And what we normally say is that if your period's more than 2 or 3 days late, take a pregnancy test then. Okay, just to make sure that you're not pregnant. Okay,
yeah, that's fine.
All right, did you have any questions regarding the...
No, I don't think so.
Okay,
yeah.
So I'll give you the prescription for that, okay. And then if you were happy to just have a little chat about the other contraceptive methods, because you said you've been taking the pill, and you've been taking that for a long time, have you?
Really, since last year.
Since last year. And it's the one that you take for 21 days and have a break, is that right? Okay, but you're forgetting it now and then.
Yeah, I'm not great with taking it.
Okay. Well, there are some other options available, things that we call long-acting reversible contraception. Have you heard of that?
No.
So those are things that methods of contraception that people use, that women use, that basically are what we call fit and forget. So they can be like a coil. I know you weren't keen on coils, but if you weren't keen on a coil, there are other methods. So things like an implant in the arm.
Yeah, I've heard of that one.
Or there's an injection that you can have sort of every 3 months. Yeah. And that just sort of like gives you a little bit more protection in the fact that you aren't having to remember to take something every day. Had you had any thoughts about that?
I think the implant sounds like a better idea for me. Yeah.
So generally that would be fitted, and then you could keep it in place for 3 years before it has to be changed. So that would just take that sort of aspect of forgetting it out of the way. Okay. So I can give you some information about that. Yeah. And we can get you to either come back and think about it once you've had a thought to think about it, and arrange for you to have it fitted.
That's great.
So we can do that. In the meantime, though, if we would advise you to use, I would advise you to use condoms until you do have that fitted.
Okay.
I don't know if you've got any more of your pill. You said you run out completely.
I've run out, yeah.
So if you use condoms or abstain from sex until we start that method.
Okay.
And we'll have a chat in more detail about that when you come back, if that's okay.
Fine, yeah. Lovely.
There are always lots of things to discuss in a case of contraception. The GP has addressed the problem the patient came in with, has given her more information, safety netted it, and brought her back for follow-up to discuss these issues in more detail. She did really well to take a focused history, and she clearly elicited the duration from unprotected sex to the patient presenting, which helped drive her management plan. The only thing I would say is that the gynae history was done a little bit late and was a bit disjointed from the remainder of the history, and it may be worth doing that in the first half of the consultation. Overall, I would give Dr. Sadiq a clear pass in all 3 domains.
Is that okay?
Yeah, that's great.
All
Thank
right.
you ever so much.
Do you have any other questions at all?
No, I don't think so.
No.
That's great.
Okay, thank you very much, Jane. And we'll
Lovely.
see you back then once you've had a read through the information.
Lovely.
All right.
Fabulous.
Okay.
Thank you.
Take care then.
Thanks,
Bye-bye.
bye.